So we're looking at a side view x-ray of the lower spine for a 36-year-old patient of ours. She's very physically active in terms of her chosen career. She's on her feet a lot, very mobile. She's been dealing with chronic right hip, leg pain, some low back pain, but majority of it into her right hip and leg. She did go for an orthopedic evaluation of her hip. Everything came back clean, no problems. So we followed up with x-rays of her lower spine. I'm Dr. Tom. I'm a spinal rehab specialist. I help people solve chronic spine problems naturally from the comfort of your own home. So let's take a look. We're going to focus on two main views here. Here we have our side view, front of the body out here, back of the body over here. What we want to see in this side view of the lower spine is this good fluid arcing curve towards the front of the body, where then it's going to dip backwards, back in that very lower portion of your spine into your pelvis. But we want to see this good fluid arcing curve towards the front of the body. This makes your spine super strong, mobile, flexible. And once we lose that curvature for whatever reason, we weaken the spine, we lose that proper mobility, that we become more restricted. And now we also start to get focal points of stress. So what we do see with this particular patient is some remnants of that curvature in that lower portion, L3, L4, L5. So there is some curvature there. It's a little flat for my liking, a little higher up, that T12, L1. So a little bit of a loss of that proper structure in there. But again, once we lose that proper curvature for whatever reason, we start to get focal points of stress. So what do I mean by that is we have all this pressure from gravity, the weight of our entire body being jammed straight down. And when we lose that proper structure in there, we get focal points of stress. And that's why we see a big old disc injury at that L5, S1 region. Plus, we also see some wearing and thinning of the disc higher up in that T12, L1 region, because we lost that normal structure there. That opens the door for these discs and joints to start to deteriorate. Now, symptomatically, what we're going to see here is when we lose that proper structure and we start to get damage up in that region, that T12, L1 region, so lower back pain, but this is also going to refer pain into, neurologically going to refer pain into our hip, groin area, over the front of the thigh. And then when we have problems in that lower portion of the spine, that L5, that's your sciatic nerve region, so lower spine pain, and then problems down into the back of the leg, into your feet and toes. And once those nerves get irritated and involved, it causes problems like pain, tingling, numbness, weakness, sensitivity to heat, cold, touch. Doesn't mean you're going to have all those problems. Once those nerves get irritated, it opens the door for those problems to exist. Now, on this patient here, I said there's a big disc injury going on at that L5. We have some wear at those T12, L1 regions, some thinning of those discs. The healthiest disc that I see is at that L4 disc. Yet this is not a terrible looking lower spine x-ray, side view x-ray of the lower spine. So why do we have so much damage going on into that L5 disc? Now let's take a look at the second view. We're going to blow this one up here. This is a straight on shot of the lower spine, yet this is a motion study x-ray. So it means we have the patient bending to the right on this particular view, bending to the right like she's trying to touch the side of her right knee. When we're bending to the right, what we want to see at every level is each one of those joints moving or bending to the right. And the only one that I see moving normally is at that L4 disc. Yeah, let's go back for a quick second. That's the one I said was the healthiest disc on that side view, and it's the only one that's moving normally here. So we have a loss of function at every one of those levels, and this is critical. This is essential for the health of our disc and joints of our lower spine, throughout our spine. Why? Our discs do not receive blood supply anymore. So why is that important? Every cell, every tissue in your body is fed with blood. Blood is what feeds our cells, feeds our tissues with nutrients, pulls waste material out. That proper exchange going on constantly keeps our body healthy. Our discs do not work that way. Our discs only stay healthy with proper movement. And we call this repetitive tractional type movement. So constantly putting pressure on the disc, taking pressure off the disc, pressure on, pressure off. When we put pressure on the disc, that drives waste material out. When we take pressure off the disc, that pulls nutrients and water in. That's what keeps our disc and joints healthy. Yet on this patient here, she has a loss of proper function at every one of those levels except for L4, and that's the only disc that's staying healthy. So we have a loss of that proper function, plus we have a loss of that good curvature going on in the spine. Those two together make these discs very brittle, make the joints very degenerative. The discs become very brittle. That's where they get crushed. That opens the door for problems to exist. But this is fixable. This is solvable. Yet there is a point of no return with this where the damage gets too much. And this is where you open yourself up for surgery. She is not at that level yet. But the way we will start to work this is we're going to work with a process of 3 procedures. When we start to work this, we have to start procedure one is release the muscles. We have to get all these muscles in the spine working better. Release those muscles, warm them up, allow those muscles to move better so that they can get these joints to move better. But yet we have to go above and beyond, because once we get damage being done to these discs and joints, our game plan has to reflect that damage. So we can't just focus on stretch, strengthening work, core work. We have to build better mobility in there, and we need to drive that repetitive tractional movement into that lower spine. And that needs to be done on a very consistent basis. You can't do it once or twice a week and expect to get great results. We need to be doing this on a more of a daily type of basis. Drive the repetitive tractional movements and all these discs and joints. Get that proper exchange of nutrients in, waste material out. That needs to occur on a daily type basis. And then third component is we need to build better structure in here. We have to build better curvature into that lower spine. Again, it's not terrible, but we need to build better curvature in here. And that's where we get our long-term results with. And when we do this in the proper sequence, do it consistently, this is over a course of time, this is where we can start to see long-term great changes, not only with the health of our disc, obviously symptomatically can improve, but this is where we can build long-term health. This is what I help people do at home. If you have problems, if you have chronic problems, you need better answers, I'd be happy to get on a call with you. Set up a time. Let's get on a 15-minute call. Let's go over your x-rays, go over your MRI reports, whatever you have. We can see what's going on in there and how we can help you. I look forward to working with you. Let's get moving.